Let me turn the recording on. Hello, everybody. We are going to start momentarily. And hold on, I'm just making sure I'm pressing the right buttons. Yes, people are coming in. We are being recorded, so we are good. This is going to be a very good session. We know it's going to be, oh, wait a minute. Not yet, not yet, not yet. Don't go there yet. Here we go. All right. Looking like we're getting more and more people. Looking good. Oh, they're coming in, Dave and Yona. They're coming in. It's wonderful.
Finding their seats.
They're finding their seats. Looks as though one person has their umbrella open. It was raining apparently where they're living. You know, we'll just give it about another 10 seconds and we'll formally begin.
Yeah, let them get the coffee.
Coffee. I think the coffee's better this month, Dave. Yeah. You know why? This is for our Canadian listeners. It's Tim Hortons coffee. It's Tim Hortons. It's not this Dunkin' Donuts stuff. Ugh. Ugh. Let's see if we get comments in the chat box about that. Okay, it looks as though we will begin. Here's a formal welcome. Welcome everybody to April 2021. Oh my goodness, April 2021. This is, I think, an hour that's going to really hit home for all of us. We love the title of this very academic webinar, Finding Our Way Out of This Hot Mess called COVID-19. We all, I think, can appreciate that. And I think what Dave and Yona will do is really talk about some things that we've all experienced this last over a year now. This is Let's Talk. This is our monthly program that we do in concert and in partnership with the International Journal for Direct Support Professionals and the National Alliance for Direct Support Professionals, VITA, Community Living Services, and HANDS, the Family Help Network in Canada. For years, we've been partnering together to bring these monthly webinars, quote unquote. It's different than a typical webinar, we would say, and we're very proud that it's different because what we try to do is have the authors of the International Journal for Direct Support kind of dive deeper in what they've written. And Dave brings people through this little journey for an hour on talking a little bit more in depth about what has been written. And that's the purpose of these Let's Talk webinars. They're more like a podcast, they're more like a radio show, and that's what we want them to be. Yes, we want to give you information, we want to give you data, but we also want to make sure that it's accessible. We know that direct support professionals, they appreciate and enjoy stories and really enjoy real life situations, to hearing about what they can do. Direct support professionals are very practical people. So what we want you to do, and the objective of these Let's Talk webinars is exactly that, to take this conversation and continue it after this is over. So we're glad you're here. My name is John Raphael. I'm the Director of Educational Services at the National Alliance for Direct Support Professionals, and I'm just kind of just going to do the controls here so that Dave and Yona can have a great conversation. Before we get to them, real quickly, you can find the April 2021 issue of the International Journal for Direct Support Professionals online at www.vitacls.org, which is right there on your screen. You go to that website, that's the VITA Community Living Services website, and you'll find learning resources, direct support professionals, and boom, you will be then brought to an archive of over 10 years of these articles. Very impressive, wonderful, a treasure chest of great information for you. Please go not only pick this one up, but look at the other ones. The International Journal for Direct Support is published in English, French, and Spanish. So please take advantage of that resource. Next month, Dave wrote the May issue of the International Journal of Direct Support, and it's called The Art of Apology. So please tune in, and Dave and I will have a discussion about his piece. We don't have the date yet, but look forward to that soon. Let's talk about this hot mess. Let's get out of this hot mess, friends. I'd like to introduce today's author, Dr. Yona Lusky, who's with us again. Dr. Lusky has done a few of these with us, and always to rave reviews, and it's always great to have Dr. Lusky here. A little bit about her. Yona Lusky is a psychologist and director of the Azrieli Adult Neurodevelopmental Centre at CAMH and H-CARDD, and she can tell you what those mean, and what those acronyms are. You can find helpful COVID-19 resources at H-CARDD COVID webpage, which is right there. You see it on your screen. If it's not on your screen, it'll be translated into the closed captioning. And please, if you need closed captioning, it's right there at the bottom of your screen. CC, press it. You'll get subtitles and a full transcript along with all these resources. And please feel free to email Dr. Lusky at hcard@camh.ca. And I'm sure she'll give you that information again. And then Dave Hingsburger, who is going to have the conversation with Dr. Lusky. Dave is our longtime colleague and friend, and retired. You're retired now, Dave, right? Kind of, sort of. Maybe you're more busy now that you're retired. I don't know. But there's Dave. He's really cool. I'm going to shut up. I'm going to let them talk about this hot mess. My friends, Dave and Yona.
I just noticed this picture of myself here. That's back in the days where I thought shaving was really important. Not anymore. I'll tell you, the pandemic has really affected that. Okay, if we could go to our first slide. Oh, let's go to our first slide, please.
Yes, go to. You want to do the poll or the slide?
Yeah, I'd like to do. Yes, I want to do them both.
Okay.
So let's do the poll.
Let's do the poll. Here we go, everybody. Dave, you can read the poll. Here we go.
I shall.
And
do you see light at the end of this COVID-19 tunnel? Yes, no, or I don't know.
Ooh. Wow. It's an optimistic group. I'll just give you that hint. All right, we have about 90% of the vote in. All right. Looks like we got most everybody's voted. So let's end the poll. And here we go. Ready?
Okay, so do you see light at the end of this COVID-19 tunnel? 68% said yes, 10% said no, and 22% said I don't know. So it's really interesting to see where people are and what they're feeling, and some of this may be regional because we were talking just before that up here in Canada, we're really struggling right now with COVID, and in Ontario, it's just at crisis level. So it's really hard to see the light at the end of the tunnel with these things. Are you seeing that as well, Yona?
Yeah, I think actually when I wrote this, I was in a slightly different place. I probably would have said yes. We're just on the cusp. And I think certain days, certainly today, I actually selected I don't know, because I think it changes by the hour for me how I'm feeling right now.
Yeah, it really does. It really does. Okay, so let's move to the next slide, John. I thought you had one that said, why did you write this article? So I'm going to just start there because we always do. So why did you write this article, Yona?
Well, it was interesting, Dave. I think when you asked about what was on my mind, I was thinking I could write something about vaccines because that's really been a big focus of what I've been doing in my work lately. And it's a priority issue. But you already were getting some stuff on that, and we realized there were other things to talk about as well. And so I thought, it's a year in. By the time this article comes out, it'll really be just after when everything shut down in Toronto and in Canada. And I thought maybe we need to just think about where we are, because if we don't embrace where we are, we can't think about how we're going to move forward. So I thought, maybe just an honest reflection and some of the work I've been mulling about in my own head, it might be interesting or worthwhile to share that with people.
Yeah, and I think it really was, because as you said, we had to like embrace the loss and then plan for the future. So we can go to the next slide, John. So what have we collectively lost? Can you talk a bit about this?
Yeah, I mean, I can go through the different categories that I came up with, and as people watching and participating with me, there may be other areas for sure that I didn't cover. Those were kind of the ones that were front of mind for me. But I think collectively lost is really important here, because I think in order for us to unite ourselves with our coworkers, with the people with developmental disabilities that we're supporting in our work, with their families, with the people who piss us off, who could be in any of those groups or in other groups as well. This collective experience, I think, is really important, because it's actually maybe one of the first times where it's so obvious what we share with other people. And I think, not only appreciating kind of what your own loss is, but recognizing that other people have had that same loss helps us maybe shift our perspective around how we interpret the loss that they've experienced, and can bring us a little closer together. So, I don't know if you want to comment on that, Dave, before I could talk forever. So go ahead.
Well, I just think that there is something really unifying about this, because there is so much loss, and you can really see how it affects various people in various ways. And even if they feel lost in a different way than you do, you're still feeling lost together. And there's something shared about that experience. So there is kind of a unifier, and I think it takes away a little bit of the hierarchy between ourselves and people with disabilities, because this is something that it's not something they have worse. It's something that they have that's theirs, and we have that's ours. So I think that's an important thing to remember.
Yeah, no, I think that's exactly right, Dave. And I mean, sometimes I do think in some ways their experience of it might actually feel worse because of additional barriers and challenges that are sort of beyond their control. But at the same time, what makes something worse for me or worse for you isn't just about the objective, what's happened, but it's also where we're at, how it impacts us, how we interpret it. And that can really vary. The exact same situation affects people differently. And it's not just because you have or you don't have a disability that something impacts you. I think what I tried to do when I wrote about some of these things, when I wrote about, loss in health, I tried to kind of pick out what are the exact things I'm most concerned about as a clinician right now around the health of people with developmental disabilities a year after, for some of them not leaving their home, right? Or knowing that people with developmental disabilities are more likely to have had health issues before the pandemic started. So we all, I think, have lost health. We're all in some ways, for many of us, have new health problems we haven't been able to get healthcare for easily. Certainly have mental health issues that have emerged, right? So that's common. But I think if you have a harder time figuring out how to access healthcare, if healthcare workers are less familiar with your disability and what that means to you, and if your health was worse before everything started, it's that much more maybe of an issue for some of those people. So it's almost like, let's think about how it's collective for all of us. And at the same time, let's think about what's unique for people with developmental disabilities. And that's really important.
And even with the unique experience that people with disabilities have, I think it's really important that, I mean, there are very few times in society that people with disabilities are considered as part of the collective, you know, as part of the whole. And that to me is kind of important. And even though it's about loss, that the idea that we think and speak of people with disabilities as having an emotional reaction to the world that's around them, as having a feeling response to the things that are occurring with them, is well, I mean, to a certain degree, I think our work is always to help humanize people with disabilities to the community, but also to ourselves as well in our work with them. So I think that's an important thing that we can exploit in our own relationships and discussions with people with disabilities.
Yeah.
When I looked at this particular list, I found that this is really a powerful list, and I'm saying that for a couple of different reasons. One, I mean, I read it just as a person, but I also read it as a person with a disability. You know, because as you said, you know, things impact people with disabilities differently, and I'm finding that with this pandemic, I'm virtually housebound. You know, there's nowhere to go. The weather has not been particularly welcoming to a wheelchair, and it makes it very difficult to get out and experience. Joe goes out every day, you know, and I'm now going out like every week and a half. I look forward to going to the grocery store to buy a couple of loaves of bread when we do that on the weekend, and think, oh my God, my life has turned into, I have an outing schedule.
Yeah.
Which I never thought would happen with me. So I think that kind of impact is, it's almost really hard to explain to somebody else that experience.
Yeah, until you stop. I mean, there's so many people. I know even in conversations I've had sometimes, you know, with DSPs, feeling like, well, all of us are indoors right now. You know, it's hard for everyone. I'm like, yeah, it is. But you know what? You're still getting into your car, even if the only place you're going is work.
Yes.
Getting dressed, you brush your teeth, hopefully, whatever, you eat your breakfast at a certain time, you get in your car or you take public transit, however you have to travel, and you go somewhere else and you enter that place. So you take off your coat. You know, you see something different, like there's something that you're doing. For someone in your situation, Dave, you may sort of start your day because you have appointments on Zoom or whatever you're doing. But if you're actually not leaving your home, there's just certain things we do naturally with our bodies every day that you might not be doing, right? If you're not leaving your house. And so that makes a difference, I think, for people.
Oh yeah, and the whole routine has completely shifted. And I'm not somebody who was addicted to routine, but I didn't realize how much I needed it and how much I miss it now that it's gone. You know, and I worry about what that means for the future. You know, like when I look at some of the people with disabilities that I've been working with, not just at VITA, because I'm consulting in a variety of different places now, is that for some people with disabilities, it's really easy to see the impact and the loss. These are people who go to the community, who love being in the community, who had day programs and so forth that they enjoyed going to. They had community supports in one way or another, and those are all gone. You know, and you can see their loss, and often they can articulate what that loss is. But there's another group of people with disabilities that is experiencing something very different. Those people who came to us from institutions and had lived for many years in an institutional environment, and you see them slipping away from freedom and back into the passive role of being a patient or being somebody, an inmate on a ward. And you kind of worry about, their loss may not be as obvious, but it's really there. And you worry about how are we going to revigorate their appetite for community, when it's so easy for them to be in this passive role.
Yeah, and I think, Dave, there's two things I think about when you say that. I mean, one, I think, is this issue of how long it might take someone to learn a skill, and how quickly a skill can be lost. And sometimes it can be relearned, but sometimes it actually is very hard to relearn something. So even, as the pandemic, gets closer to ending and we think about returning to something, some of us it's going to be easier for us to do that than it is for other people, right? So I think for some people that loss of skill is very significant. But the other thing I think you touched on is this issue of trauma. And, whether it's someone who was institutionalized in the past, is now in the community and is now pretty much locked in their home, and that sense of it being as though I'm being institutionalized again, right? Or even just, the trauma, if it was the very first time someone went into lockdown was in, March, April last year, and then you have another wave and it happens again, right? So you started to be able to leave your home and now you can't anymore, right? So every time things get worse, I think, it's reminding us of how things were worse before, whether it was 4 months ago, a year ago, or 10 years ago. And so there's that element of trauma, I think, that we don't always think about, but it's like the one experience we're having now that's difficult isn't just this experience, it's how I remember how this experience reminds me of other experiences, right? Yeah. Which might not, some people can't express that at all. And we only can, guess that might be going on if we know people's history to know what they're thinking of. And often we don't even have that story of somebody's to know that piece, right? But everything that happens, I think, is a loss as well as a reminder of a past. So even, the issue of time with family and friends or saying goodbye, and when someone dies or when someone leaves you, it's not just this time that it's happening, but the reminder of how that happened before that gets triggered, I think. So it's sort of cascading in that way, I think, and really difficult for all of us, but certainly I think for the people we're supporting who have disabilities.
Yeah, and when you talk about skills being lost and being regained, we say that, like you say, as if that's an easy thing to do, but I have to tell you, when I lose skills or whatever, I don't have the energy to do it again. Yeah. I mean, forget, do I have the capacity to do it? Do I want to anymore? Where does that energy come from? So I think the cost to people is extraordinarily high. And one of the other things I find is that, when I talk with typical people, that there's so much confusion. And I hear questions over and over, well, how come I can't buy this at the store, but I could buy this at the store? And it doesn't make sense to me that this store is open and this is not. And I don't understand how you could have this many people at Costco, but you can't have this many people in a coffee shop. And that's non-disabled people, that have incredible confusion around the rules and what they mean. And the longer this goes on, I find the more anger has been attached to that argument. Like people aren't getting it in terms, I mean, they get it. We're in a pandemic and it's serious, but they don't get it, how these rules are being made and who makes them and how that governs their behavior. And it sort of strikes me as kind of funny, because often I think people with disabilities look at us as direct support professionals or as staff, as the people who are the role setters, you know, and now we understand what that feels like, but there is confusion, and it's hard to explain.
Yeah, I was going to say, you know, I think that the what helps us with relearning things has to do with our health, our joy, our trust, our family and friends. So when we lose all these things at once, I think they kind of affect each other. And I think the rules and the not understanding them really fits into this issue of trust, right? If we can't make sense of what the rules mean or why they're there or who made them or what we're supposed to do with them, we start to get a little bit, you know, less trusting of so many things. So it almost like makes it harder to do so many other things, right? So these things are all affecting, I think, each other. Have a
Yeah,
key
I agree.
on this.
I agree. So one of the things that I was wondering when I read this one, when you take a look at this list, what are the top of the three things that you think affect people with disabilities the most in this list?
That's a hard, yeah, I mean, personally, I'm a health researcher.
Yeah, that's why I'm asking.
I think, yeah, so I think the health one probably goes on my list because there's no argument, like hands down, people who have worse health in the first place and who we don't make healthcare as accessible right now, that's a harm. And health can get better over time. Like you say, it's harder to have the energy to do those things you need to do over time, right? So that's a real risk. You know, joy is an interesting one. I think we've all lost joy, but some people, like you say, and some people I think with disabilities are used to sometimes living in a smaller world because of the circumstances they've had. And, you know, I think what makes a person find joy is really, I think it relates to that person's environment, but also kind of how they are and how big their world needs to be. So I'm not sure if joy would be the one that's on there or not. I think we've all lost some joy, but how people are managing, we're seeing that some people are managing not as badly as others within the disability community, right? And maybe that's partly how much joy each person has lost, and some people have lost less than others. I think time with family and friends is an interesting, it's a really important one, especially if family and friends are really important to you, or how you define family and friends, right? And I think we've all lost that, especially if we're following all the rules and things that are outlined for us. But we might have different degrees of need of how much we need to like be in touch with our family and our friends. And whether we need to like just know they're there, but we don't actually have to talk to them. If we need to see them in person, if we need to hug them and touch them, or if, you know, being virtual, having a conversation, sending a text is enough. So I think for some people in the disability community, especially people who are living in, you know, settings where they're getting staff from outside their home coming in and they're therefore not allowed to get out and do as many things with their family as they would like, and they don't live with their family or their friends. But that's a huge loss for them that maybe some people aren't experiencing to the same extent. And for some of those people, you know, the virtual alternatives are not enough. I think that can be a really big loss, again, for some people, not for everyone. You know, it's interesting, lost opportunities to say goodbye. Sadly, I think if we think about things like grief and some of the things you've talked about over the years, is sometimes we've been not allowing people in the developmental disability community to have the opportunities to say goodbye for a really long time. Yeah. Right. So whether it's someone that they didn't know was ill and was dying, who, you know, maybe dies and it's one of their roommates or something, and they didn't have a chance to prepare for it or know what was going to happen. Or if it's a friend in their life who they thought was a really good friend, but just kind of moved out of their life, or a staff that came in and left at some point. I think those losses happen a lot more in that community. And sometimes they, even before the pandemic, I think could miss opportunities to say goodbye. But I think what's the new struggle now is that even when we want to provide those opportunities, we can't do it in as obvious or in person a way as we would typically have done it to have that kind of closure. And again, I think sometimes that affects all of us, but it might be harder for them to understand that if they can't actually go to the place to see where someone has left, you know, or have that opportunity to say goodbye.
Yeah.
What would you pick, Dave? What are your top three?
I agree with you, health, and I would break that into physical health and mental health.
Yeah.
You know, because the mental health impacts of COVID and of quarantine and so forth, I think are astronomical, and we have yet to pay the full price on that. I'll tell you, I think it's again, it's indescribable. You know, just before this last wave, I was in the hospital maybe 8 weeks ago, and I was taken into the hospital, and it was awful. I mean, it was just awful. Not just because I needed care and I wasn't feeling well, but I was alone, like completely alone. You know, and I'll tell you, the phone calls don't do it, and the video calls don't do it. Nothing does it. And I got out of the hospital, and I was hugging Joe like at the door of the ward, you know, because it's indescribable, that sense of loneliness and isolation that you have, and powerlessness about it, you know. And as we provide opportunities to people with disabilities to do the virtual connection and do those things, it's just like, it's not I mean, it's good that we're doing it. We need to think about it, and we need to be creative about how we do it, but it's not enough, you know, to meet what those needs are. So I think that that's an important thing to look at. So health, both physical and mental health. And then I was having difficulty with, as I thought about this, the difference, trust or joy, because for so many people with disabilities haven't really lived joyful lives, you know, and haven't had, like, I think that their connection to joy is often much more tenuous, you know. Yet I think it's so important, you know, when people with disabilities get to experience just some of what that is. So health, joy, and trust, I think I would put. So my next question would be, which three do you think are important for direct support professionals? Are they the same?
Okay. Yeah, you know, I would say, and maybe this is a cop out of an answer, but, you know, I think which of these things are important to you is very personal.
Yeah.
And it might have to do with how important those things were to you in the first place, or how much you've lost in any one of those areas. So, you know, if you're like really focused on your work and that's the most important thing, and your family and friends aren't the things that nurture and strengthen you day to day, then maybe that's not going to affect you as much. If you live with a really big family, so every day you go home and they're still there, you know, or you live with your best friend, then you maybe not losing that quite as much, right? So it has to, you know, if your health has always been great, then maybe you're not impacted that much by what's going on right now if you haven't gotten ill with it, right? So I think it does depend on the person a little bit. But at least to some degree, I think we can, the important thing is that we can each relate to each one of these areas to some extent.
Yes, yeah, I think you're right.
Thank you. Didn't mean to interrupt, but there's a great comment, like, I think we need to address this if you could, from Leslie Udell. Thank you, Leslie. People may be desperately missing touch, and it's so difficult to address when they're only surrounded by staff who must continue to be aware of the ethics of touch. Could you?
Yeah. Can I respond to that for a moment? Because when you were speaking, Dave, and you talked about that moment where you could hug Joe when you were leaving the hospital, you know, I was thinking about the series you did. Wasn't it called The Ethics of Touch?
It was.
And I was thinking about one of the very first presentations I heard you give, and I won't say how many years ago it was, but I was a grad student, so we're going back a couple, in San Francisco at the AAIDD conference. And you talked about how important touch is. and the different ways we can have touch. So some of that we'll get to when we talk about opportunities, but 100%, Leslie, I think people who have been told, and I have a sister, for example, who is supported in a residential supported living kind of setting. And, there's no touch with her roommates. There's no touch with her staff. She doesn't need hands-on sort of care to help her get dressed or to eat. She can do those things by herself. And so to protect everybody, there's no touch happening. And even if I am able to see her, say outside or something, I'm not touching her either. What's it like for somebody who lives alone or lives in one of these settings who cannot have any hands-on touch for over a year? We can try to do all these kinds of things, but I think that the loss of touch, that's where we have to get really creative, I think, to make sure we can keep some aspect of touch there, but the usual touching is absent. And I think that's going to have major, major impacts in the very long term for people.
Yeah, and I'd like to say the thing with the ethics of touch, which if you actually listen to the presentation, it's not an anti-touch presentation. I state very clearly that touch is important, but we need to consider how we use our touch, and what boundaries are necessary in order for people to be safe in our support of them. But I talk, famously about the side hug, but there's several different kinds of touches that you can do, which are completely acceptable, and we need to think about as we create these boundaries, that we don't build a wall. That's not. It's like, no, you can't never touch somebody. It's like, how you do it, under what circumstances, for what purpose, and so forth. But the ethics touch are still really important, and I still support all of the boundaries that come with it. But there's a lot of leeway, in terms of.
Well, I think there's a lot of leeway, I think, in regular times. But when we have additional restrictions put down, and sometimes we feel like it means you can't do any kind of touching because of the risk of being so close to another person.
Yeah.
That's another. That's another area. I think we need to start thinking about how people can have experiences that are sensory and that are affectionate without risk, and how we creatively find ways to make it feel as though I'm being hugged or I'm being touched or supported when I can't have that touch,
Somebody named Leslie, hey Leslie, said people with disabilities have disproportionately lost their rights. Could you write a little bit more about what you're seeing, Leslie, so that we have more of an understanding? And I vote McDonald's. So, anyways, so let's move to the next slide. All right. John, can you alert me when we get a response?
I will do, Dave.
Okay. So moving together, and one of the things I liked about this article was, okay, we talked about the loss stuff, and then when you take a look at your solution is togetherness, and there's all sorts of ways of being together. So let's talk about what some of these things are, and how you're hoping people will use these as a roadmap to get from here to there.
Yeah, I mean, I think, again, if we sort of go with this idea that there's something collective that we've lost, there's also some things we can do collectively to move forward, right? And I think we have an opportunity, like I can say, go home, exercise, bake your bread, take a walk, do something creative, take a breath, your tears, and then go back to work, right? But there's something powerful when we can feel like we're taking these actions that are good for us and that are good for our communities, but we're taking them together. I think where we have to get creative is we can't necessarily like I said, we can't necessarily touch together, right? I can't just go and hug everybody I want so that I can have that experience of touch. But there might be something that I can touch that someone else can touch at the same time, right? Even if we're in two different places, there might be something we can work on in terms of exercise, you know, where I could exercise by myself, but what if I got to exercise at work? Because this issue of, there's a term in hospitals, I don't know if you heard this when you're in the hospital, Dave, called pajama paralysis or PJ paralysis, which is this idea that like once you're in the hospital and you get in your gown and you lie on your bed, that's it, right? You almost develop this kind of paralysis because you're not getting dressed, you're not moving. So people who are staying home, who aren't doing a lot, if they're not able to move their body however they can, even if it's just their arm or something, right? So if we could all do a little bit of that movement together, then we're getting some of our exercise and movement in, as well as the person we're supporting with a disability or with fellow staff or whatever, you know, so it's kind of a way that we're doing something for ourselves, but we're also making it an activity we're doing together. So, I mean, I think if I was to pick my top ones here, for sure, I think getting outside as the weather's getting nicer until it gets unbearably hot. One of the very best things we should be doing is getting outdoors and getting fresh air and rolling or walking or sitting together, right? Just in a space that is not necessarily indoors in our rooms where we were before. I think any kind of fitness or activity we can do to share that and make that part of what we do when we're on a shift with the people we're supporting. And then the other ones are, I think they're really neat ideas. This idea of, I've seen, you know, if you can't, one of the things I miss the most, you know, from before COVID is that if I had a meeting with other people, and part of what we did is we broke bread together, or we shared a meal, or we passed around a treat, you know, we all stuck our hand in and did all the things we shouldn't do anymore. How lovely that was, right? So we can't do that. But, you know, you've seen people like making things and dropping them off on the porch of somebody else's house, right? Or I've seen like Zoom cooking things where everybody's like on Zoom and they're baking the same thing at the same time, you know? So there's still ways for us to make things together, even if we're not actually together, right? And if above all else, I put these ones at the bottom, you know, if you can't think about how to do some of the things I put near the top of the list, you know, so long as we're alive, we're all taking breaths, right? So if all we do, and we can do it right now, Dave, you and I and everybody here, we can all just stop everything we're doing for a total of about 50 seconds or less, and we can take 3 breaths together, which is really powerful. You just stop, I'm gonna stop, and I'm just gonna close my eyes and breathe 3 times, and that's all I'm gonna do. You know, so long as we're breathing, we can breathe together, and we can pause together. We can notice something pretty, or smell something, fresh air outside or something. There's something we can do together where we're just pausing, you know, and I think that's,
and you know, and that pausing, it has to be really kind of intentional, because I found myself in doing this, I enjoyed the sensation of just breathing, but my mind was going, we're on air, the camera's on me, we got to be talking, you know what I mean? Like, because there was so much noise up here, that I had to actively work to just go, hush, just hush, you know. So I just told myself to shut up. So
Dave, that's why I came on, Dave. That's why I came on, because I wanted to be part of the group. And it would have been great if we could get everybody on the screen, 100 and some odd people, but that was beautiful. Thank you, Yona. Hey, Dave, as promised, here's the comments from Leslie Udell, and I'll read them to you, and then you can discuss. So there are far more restrictions on what people can do and where they can go when they live in group living situations. There are added restrictions because of our need to be highly protective of people, less dignity of risk than the rest of us have access to. Unfortunately, many agencies have added restrictions to the lives of people in order to provide what they feel is greater protection for their employees and other supported individuals. So that's from Leslie, and I'll let you guys have that.
Yeah, we have this this balance right now, I think, of trying to keep people safe and trying to keep people well, right? So, you know, there are things we have to put in place that are bad for our wellness, but that can promote our health and our safety. And some people are at greater risk than other people because of where they live, because of pre-existing health issues. But we have to always think about how we're balancing that out, I think. For an individual, like every individual is different. So we might have like a rule that goes for a sector, or a rule that goes for an agency or a home. And rules really have their place, but we have to be thinking about how that is impacting that precarious balance of safety and wellness for every person. So.
Yeah, and I think that, I mean, one of the things that I've worked with agencies to develop is a Bill of Rights written by people with disabilities for people with disabilities. And I don't think it's a bad idea if you've got one of those in your organization to go back to it and work with people with disabilities about the issue of COVID from a rights perspective, so that it's not something that an agency is doing unilaterally. It's something that it's doing with people with disabilities cooperatively. Because I think that that's an important aspect in the work that we do. I know that the whole system isn't at that point yet, but there was movement. Because I know of several organizations that have these Bill of Rights as done by people with disabilities, and that they're actively using them. I know the one at VITA is actively used by VITA, and the members have tremendous ownership over that. And I think that a cooperative venture would be great.
Thanks, Dave. I wanted to comment on one more before we go to the next slide, and it was the crying together one. I think, you know, I just finished doing some teaching today on the topic of grief and loss in our sector. And, you know, we think about all the things we lost on the last slide. Sometimes it really does make us upset. And I think, again, in this kind of effort to be the fixers and the positives, you know, rosy, things are okay, we're optimists, we work in this sector and we love what we do. We don't actually model to people with disabilities that sometimes it's really bad and we feel sad. And I think allowing us to feel sad in that moment, the same as we can take a breath together, we can cry together, and we can notice whether it's with coworkers or the people we're supporting, if they're sad or if we're sad, we can name it. And sometimes we talk about, hey, name it to tame it. Like if you acknowledge what you're emotionally experiencing, then you can start to deal with it. And if you see that what you're experiencing emotionally is actually shared by someone else, even if they can't fix it, it does almost have a healing power by sharing that emotional moment. So I think that sometimes crying together might be exactly what needs to happen, and we shouldn't feel ashamed of that. And we should have space for that, I think, when it needs to happen.
Yeah, and you know, that was one of the things that I really noted when I read this. Particularly the idea that we don't need to be tough all the time, you know, and I think that is suggesting that we can actually allow our own vulnerabilities and our own sensibilities to enter in our relationship with people with disabilities, because there is a real need for us to be authentically ourselves in our work with people with disabilities. And if my authentic self is sad, you know, the happy face that I put on and the smiling activities that I want to do really, I think that there's such a disconnect sometimes that it makes the sadness greater. You know, it doesn't actually leave anything. So that idea that you don't have to be tough all the time, I think that's really important.
Yeah,
Okay, so we're getting on, so let's move. I think we have one more slide. So making mistakes, forgiving, and trying again together. So can you talk about what you were thinking about when you wrote that?
Yeah, I mean, I think sometimes, going back to that comment around trust is something we've lost. Sometimes people lose trust in other people because they said it was going to be this way and it wasn't, right? You said it was going to get better by the summer. You said that, you said it was transmitted by droplets and not by aerosol. You said that, this vaccine would work guaranteed, at this, like, we're always learning about this pandemic and what our rules are. Everything is changing. We're trying things thinking we have the best intent. And sometimes we go, wow, look at the evidence now. Maybe actually that wasn't working as well as we thought. Or now we have new evidence. Or now what we did before we realized with this variant is not enough. We have to do this as well. Right? So it's got to be a learning kind of system where sometimes we try our best. We trust that people are trying their best. We make mistakes. We have to forgive other people when they make mistakes, and we have to forgive ourselves. I think we have a lot of moral distress right now because we've done things that maybe we wish we didn't do. But we have to forgive, and then we have to keep going as soon as we're able, right? To try again. And I think that's again a unifying thing. If we recognize collectively that we're all making mistakes, doing our best, but we can sort of come to terms with and accept those mistakes and keep trying. If we feel everyone doing that at the same time, maybe that's another way I think it can help us get through this and get to that sort of endpoint, whatever that's going to be.
And I think sometimes that this can be almost healing. I was thinking about when I came out of the hospital this last time, Joe needed to help me a bit more than he did before, and I found that really frustrating. I was angry about the situation, and as a result, I began to be really short with him, and it wasn't what he was doing, wasn't how he was doing it. It's that he had to do it. Do you know what I mean? And I was up in the morning and we'd had an interchange, which I was not proud of. So I had to say to Joe, we need to talk. So I explained to him, I'm feeling this right now, given the situation that we're in right now, and I don't like having to ask you to do this other stuff to help me. And so I'm getting angry at you, and so I said, this is what I want you to do the next time I behave that way. Just say, pull it back, Dave. Just pull it back, and I'll remember it, and I'll do that. But I need you to know that I know that I'm being an asshole. And that was a really important discussion to have.
Yeah.
And I think that just acknowledging that, we're in this all together, and some of us are in this all together with people of a lot more than we're used, so how we just are with one another, I think really matters. And it's okay to say, I'm not always at my very best.
Yeah. No one is right now, right?
Yeah. Well, yeah. I like to tell myself, everybody on Facebook, they're at their best all the time. I have no way that I can live up to any of those things.
Yeah.
So, yes. So is there anything more there you want to say?
No.
John?
Well, there's one question that's open. It's kind of a complicated one, but at the very least, I want to respect the person that asked it. How do we overcome the difficulties of some of our clients' unwillingness to get vaccinated? What is a tip for helping them understand that we will be restricted on some of these activities and cooperative events because they choose not to be vaccinated? That's a tough one.
That was the other newsletter I was going to write. Just teasing. I mean, I think
Okay, well, we'll line you up.
yeah, it's you know, it's a long answer, I think, to figure out how to support people around vaccination, whether it's our family, our friends, you know, our coworkers, or people with disabilities. I think it's really helpful to understand what's behind that, to figure out how to respond to it, right? So the behavior is, I don't want to be vaccinated, or I'm not getting vaccinated at this moment. Is it a fear of needles? Is it not trusting the science? Is it being afraid to leave the house? Is it, you know, wanting to be able to exert their own choice? It's one of the very few things you get to make a choice or a decision on. You know, like, what is behind it? And maybe when we understand that, we can figure out how to respond. And I think, you know, for many of us, we don't like to be told what to do. And it's helpful to have discussions that allow us to understand what the decisions are that we're making and why. And so I saw in those examples, you know, there are certain things that will happen if you choose not to do this. How well does the person understand those things? How well they understand the various risks and the burdens and the benefits and whatnot? So it's a pretty complicated answer, but I do think it starts with understanding what's behind what they're relaying, and making sure that everyone we know, whether they have disabilities or not, are invited to have conversations and learnings that are not kind of forced or assuming we understand where they're coming from when maybe we don't. So we have some resources actually on our hcardcovid.com page that I mentioned. We have a number of resources to help different groups of people understand some of the issues around vaccination. So if that's helpful.
That's
Yeah, I think you help somebody differently who doesn't want a vaccine because their parents are anti-vaxxers versus I don't want a vaccine because I'm scared of needles. Those
Yeah.
are two entirely different approaches
Yeah.
that you would have to deal with.
And there's what Dr. Lusky was talking about, how you can get the COVID-19 resource. And also we wanted to do, and if everybody could just take a second, go into your chat box, if you would, or the QA, it doesn't matter, but chat's probably better. And just, where are you from? Where are you listening and watching from? What town, province, state, country, planet, galaxy?
Oh, Tucson, Arizona. Moosta.
Wow. Toronto, Huntsville, Ontario, Herkimer.
Yeah, I think I was going to say people are from all over, but it is important, really. We were talking about this before we started, that, you know, what's happening right now, whether it's about vaccines or mental health or anything else, is very much related to what's going on in our own context where we live right now. And it's also related to all the things that have already happened in our context where we lived before. So, you know, I'm seeing in New York State, you know, you clearly had a really very frightening, serious, you know, introduction to COVID that other people didn't have in other places. And as I said, living in Toronto right now, where so many people are testing positively and we're in terrible trouble, we have a situation now that we didn't have before. So understanding context, I think, is really important. And recognizing that even though we're all dealing with COVID, we all have very different experiences of what that means. So that's important.
And I just, we not only have people in from Moose Jaw, Canada, we've got people from Goose Creek, South Carolina. Hello. Hello, Goose Creek. I know who you are.
I love people who live in towns that have cool names.
I know, right? Well, look, I'm just enjoying seeing where people are coming from. So I you know, I'll get out my map and look later.
I was going to say, that's one of the beautiful things actually about the pandemic. You know, there aren't that many. We can count them on, you know, one or two hands, but it is pretty delightful to be able to realize we're all dealing with the same thing at the same time, all over the place.
Amazing.
You know, and we found ways, not even just for ourselves, but also for the people with developmental disabilities who did not use technology at all. You know, to some of them, not all of them, be much more able to connect and interact in this way. I think those are some things we don't want to lose, you know, moving forward.
Absolutely. So we have come to our time to end. Thank you, Dr. Lusky, for so much. This is a really great conversation. This art, please, everybody, if you haven't read it, download it, read it. So good. So good. Dave, thank you for pushing this conversation to a really great place. Thank you all for tuning in. Tune in certainly next month. Check us out. We've got tons of webinars in store, continuing on our mission to give direct support professionals what they need to make their work more meaningful. And so check us out, www.nadsp.org. Also, thanks always to Dave and to Angie Nethercott. Without them, we wouldn't have these monthly journals. And let me tell you, folks, it's not easy to put out a journal every month. And thanks to these wonderful people, we get to have these monthly sessions. So thank you both. And I think that's it. Other than that, happy spring to those of you that are experiencing spring. It's 40 degrees where I live, so we'll see.
Yona, I've got you down for that article.
Okay. All right, gladly.
So
Okay.
Thank you so much for the chat, Dave and John, for organizing this. And good luck, everyone. Stay safe, stay well.
Yeah. Bye-bye, everybody.